Welcome to this month's Fit for Colorado Talk to the Doc Chat. I'm CBS4 anchor and health reporter Kathy Walsh. For the next half hour, we'll be chatting about health issues here on CBS4Denver.com. Throughout this chat, we encourage you to ask questions by simply typing them in the chat window at right, and we will do our best to answer those questions. In today's chat, we're going to discuss sleep. Too little, too much, and how to get the Z's you need. Millions of people suffer from an ongoing sleep disorder. About 20% of Americans report that they get less than 6 hours of sleep per night on average. 75% of us have sleep difficulties at least a few nights per week. And there is strong evidence that lost sleep is a very serious matter. The Sleep in America polls and several large studies have linked sleep deficits with poor work performance, driving accidents, relationship problems, and mood problems like anger and depression. Joining me today is Dr. Dawn Stanley, Medical Director of the Sleep Disorders Center at Sky Ridge Medical Center. Dr. Stanley, first off, how important is sleep?
Well, Kathy, I think you've touched on a lot of the important issues with sleep. Obviously, we don't like people driving cars on our roads sleepy. You've already mentioned mood disorders and increased incidence of anxiety and depression with lack of sleep. Probably, the biggest lack of sleep problem is what it does to our health. Obviously, if we're not sleeping well, it affects all aspects of our life, but certainly our overall health, especially our cardiovascular health. We've already talked about mood disorders, increased anxiety and depression. There's new evidence coming out that it increases the risk of diabetes, acid reflux disease.
We'll get into some of those in just a minute. Let me ask you, a couple of things that I read is that you need sleep to stay alive. It really is how you rejuvenate. Can you explain what exactly the process is? Does it just get your body recharged?
Well, sleep is really an exciting field of medicine because we can't answer the basic question, why do we need to sleep? And so nobody really knows the answer to that question, but we do know what happens when we don't sleep. Probably one of the statistics that's really fascinating to me, if we stopped eating, it would take us several months to have bad outcomes. If we stop sleeping, really we see hallucinations and even death in as little as 10 days. So sleep is a vital part of our health. All
right, so 6 reasons. The Harvard Women's Health Watch suggested 6 different reasons to get enough sleep. Let's take a look at the top 3 first off. Learning and memory. Why do you need sleep for that?
Well, when we don't sleep, we have problems processing and doing and remembering, short-term memory. Patients often come in complaining, gosh, I'm just not doing well at work. My boss is saying I'm not, staying on task. I'm slower at my job. And people, really, when they don't sleep, have problems retaining memory and doing higher cognitive functions.
So is that why you always say to your kids before a test, get a good night's sleep, and yet they want to do all-nighters? Not a good thing.
They do, and we've kind of changed our way we think about sleep in this country because, even in medical school, it was, a badge of honor. I pulled an all-nighter, I worked all day, and we know that that is just not the way to do things these days. And it's exciting to see that schools are focusing on making sure kids get adequate sleep and really trying to cut down on some of their activities so that they're not running all night and pulling all-nighters studying for tests, because you just don't perform well.
Another one, metabolism and weight. Boy, I hear about this all the time, and you always wonder, do you not sleep well because you're overweight, or are you overweight because you don't sleep well?
Well, I do think it's a vicious cycle, and I think we do know that fat-burning hormones are released in sleep, so obviously if you're not getting a good night's sleep, you're not going to release those hormones. So people who tend to be short sleepers tend to be more overweight and tend to have a harder time losing weight. And we do know that if we get adequate sleep and good sleep, and when I say good sleep, it means good sleep in bed, not with any other sleep disorders, that we tend to burn weight. Our metabolism is higher, and we tend to lose weight more quickly.
So as long as we're talking about this, just what is enough sleep? Is it different for everybody?
It is different for everybody. A lot of people are hinged on this, I need to get 8 hours. And it's probably the most common question I hear in clinic, how much sleep do I need? And we have people that come in and they'll say, I have insomnia, and when you say, well, what time do you go to bed? They say 6 p.m., and why do you have insomnia? They're up at 2 a.m. And so it's not about when you sleep or how much you sleep, it's about going to sleep and getting up feeling refreshed, and that's our goal. And there are short sleepers and there are long sleepers. Not everybody needs 8 hours of sleep. That's kind of the national average. But it's really how much sleep do you need to go to bed, wake up, and feel good.
Let's look at another reason to get enough sleep, and this is a very big one. We talk about it all the time now, safety. So many people get in their car, they have that long commute to work, and they nod off.
So this is a big public health issue. We definitely don't want sleepy drivers on the road. It's estimated that as many people fall asleep driving their cars as we have, and there's enough accidents related to drowsy driving than as there are alcohol-related crashes in the United States. I think a lot of times when there's alcohol involved, it gets blamed on the alcohol and not the lack of sleep or being tired. So it's a huge safety concern.
Yeah, another big concern are medical workers. I mean, if you're going to work, like you talked about the whole doctor issue, and you're tired and you make a mistake, I mean, these are fatal mistakes potentially. Right.
So the healthcare field, I'm very excited over the years, has really addressed that problem. They tried to limit the hours that nurses have worked over the last several years. Medical schools have really changed how they train doctors, and they're not pulling all day, all-nighters and operating the next day. So there has been a lot of changes even since I started practicing in the last 10 years when it comes to sleep and addressing sleep deprivation.
Sure, and I just want to remind everybody who's listening that any questions you have, please type them in because we'd love to hear from you as well. Let's go on with some of the other reasons to get enough sleep. We've got another 3 coming up here. Mood. Oh, what a biggie. You know, my mother used to always say, you got up on the wrong side of the bed. And I think what she really should have said was you didn't get enough sleep.
Absolutely. So anyone who's pulled an all-nighter, they just don't deal with things as well the next day, and they tend to be short-tempered, and they don't get along with their spouse, and they have short fuses when it comes to their children. And you can imagine people that have underlying sleep disorders that are literally sleep deprived every day, because it doesn't matter how much time they spend in bed, but if they're not getting good quality sleep, they're sleep deprived. And so it's very difficult to have a healthy relationship with their spouses, with their children, with their coworkers, and they're tired. Right. And they just have short fuses and increased anxiety and depression. And another point I wanted to make, a lot of times people that are sleep deprived get misdiagnosed as having underlying mood disorders like anxiety and depression, when really the problem is fixing their sleep. I can't tell you how many women especially come into clinic and they come in on a list of antidepressants, and when you look at their sleep, they're not getting any deep sleep, and when you fix their sleep, they're like, gosh, I don't know if I need that. I don't want to make the point that we should take everybody who has a sleep disorder off an antidepressant, but I think we should definitely ask questions about sleep when we're considering diagnoses of depression, anxiety in anyone.
Sure. Cardiovascular health, you touched on that a little bit earlier. Serious sleep disorders have been linked to hypertension, increased stress hormone levels, and irregular heartbeat.
Sure. And we're, again, seeing more and more in our clinics with patients, unfortunately, that have already had their heart attack, have already been in atrial fibrillation, and then somebody asks them about sleep and they sleep poorly. And the Sleep Heart Health study back in the 1990s really showed this huge connection between poor sleep and underlying cardiovascular disorders. And we're hoping to diagnose and treat those disorders before something happens with patients' hearts.
All right, and the 6th reason they say to get enough sleep, disease. Expound on that, if you will. What do they mean by that? Can it alter your immune function and actually make you more susceptible to disease?
It could alter your immune function, and again, there's countless studies showing that people that don't sleep well or are short sleepers tend to be more ill, catch colds more frequently, have more bronchitis. We've already talked about the increased risk of cardiovascular disease, mood disorders, and acid reflux disease, and there are some studies that hint that it might be a precursor to diabetes or a stress that might trigger the onset of diabetes.
And I've actually read where it says keeping up with your sleep may also help fight cancer. Do you believe that?
I do think it may help fight cancer. Again, there's a lot of exciting studies coming down the pipeline that are suggesting these things, and again, it just points to you need sleep to function well, and function well in all aspects of your life. Health-wise, relationship-wise, work-wise.
Sure. Here's a couple of questions. First
Okay.
one from Tom. Why does alcohol seem to always affect my ability to stay asleep?
That's a great question, Tom. So a lot of people that have insomnia or have a hard time falling asleep use alcohol kind of as a sleep aid, and that's absolutely the wrong thing to do. So when you first drink alcohol, you actually get more deep sleep, so you tend to fall asleep easier, but as the alcohol is metabolized, you get very fragmented sleep. So anyone who's gone out and had a few drinks and you fall asleep quicker, but then you have a really horrible night after that alcohol is metabolized, and it depends on how much you drink when that's going to hit.
So a nightcap is not a good idea? You always used
Nightcap's
to hear that term.
Nightcap's not particularly the best idea to fall asleep, no.
Oh, okay. Jennifer wants to know, why do I still feel tired after a night's sleep? I'm with you, Jennifer. It seems like I have uninterrupted sleep, but I wake up tired many mornings. I could nap every day, but that's not possible because I work. Help.
So there's a lot of things to address in Jennifer's question. Again, we said you need as much sleep as you need to feel good the next day. So, you know, if Jennifer was in my clinic, I'd ask her, well, what time are you going to bed? How long does it take you to fall asleep? Do you stay asleep? Other questions are, usually for a bed partner, do you snore? Do you kick your legs? So even though a lot of people perceive that they're getting good sleep or a full night's sleep, when we take a look at what they're actually doing at night, they're not getting into that deep level of sleep because either they're kicking their legs or they have untreated sleep apnea. There's so many factors that come into that. Having to nap every day is not normal, or having the need or the need to take a nap every day is not normal.
Oh, that doesn't seem fair.
It doesn't seem fair.
It's not normal.
But true.
Oh, okay.
But so there's several reasons, and we look at past medical history, what else is going on in the patient's health, and what medications. Medications really play a huge role into how we feel too. Okay. And medications for all diseases, heart disease, reflux disease, antidepressants really they do change sleep architecture.
Let me ask you a couple things before we get to that next question. I read that there are 81 different sleep disorders.
There are. You're not going to make me name them all.
No, I'm not. But we were going to talk about a couple of the most common. How about that?
Good.
Let's start with insomnia. You hear that term. What does that mean?
Insomnia, most people think it's just having a hard time falling asleep,
right.
But it's actually either having a hard time falling asleep or staying asleep. And we break it up into sleep initiation, falling asleep insomnia, and sleep maintenance, the ability to stay asleep. And it's a very common disorder. And a lot of times patients come in and complain of insomnia, and the first thing we ask is about life events. Obviously, if something big and stressful, a loss of a job, a loss of a spouse, a new diagnosis of cancer, a lot of times we see transient insomnia that can last up to a couple months, but after that, then we look into other things.
Okay. Obstructive sleep apnea. You hear this term.
Yeah.